So my goal over the next 5 to 10 minutes is to review the current standard of care, the unmet needs, as well as where Sozinibercept will fit in our clinical practice. Next slide. So I still remember when in training, the anti-VEGFs were coming out, and I was able to actually see what they did for our patients. They have revolutionized the treatment for wet AMD. From the approval of Lucentis or ranibizumab, the off-label use of bevacizumab or Avastin, then we saw continued innovation, Eylea, Beovu, Vabysmo, the first bispecific antibody, and now Eylea HD. So we have seen great advancement, all focused on durability. As you can see, the efficacy, though, has stayed the same for these agents. Next slide. So what are the unmet needs, right? So when you look at the outcomes, despite treatment with standard of care, anti-VEGF-A therapies, and now combo therapies with bispecific molecules, what we have seen that majority of the patients achieve suboptimal vision outcomes. When you look at data in detail, greater than 45% do not achieve significant vision gains, greater than 60% have persistent macular fluid, and 25% of patients will start to lose vision after the first year of therapy. And majority of the patients fail to achieve 20/40 vision. And that's important because that is a driving limitation, and patients want to be independent. And many of these patients cannot do their daily activities. Next slide. So what are the unmet needs from as a field? We have looked at several different things. So current unmet needs in treatment of wet AMD are efficacy, durability, and disease progression. So as I said, we have made significant progress in addressing durability with newer agents lasting longer. We are still working on disease progression aspect in terms of reducing atrophy and fibrosis. Today's focus obviously is efficacy. When you look at the recent paper we published from 2-year data from Tenaya and Lucerne studies, what we see is the visual acuity gains start to decline in the second year of treatment. And when you look at the data in detail, what you see is that 20% gained 15 letters or more, that's 3 lines, 57% with 20/40 or greater with driving vision, and 9% of patients had 2200 or less vision. So clearly it has been a great advancement to have faricimab approved, but there is an unmet need to get better efficacy for our patients so they can be more independent. Next slide. So looking at the PAT survey, which is a survey given by American Society of Retina Specialists, this survey, these results are from last year with over 1,000 retina specialists, national and international, responding. And the question was, what are the greatest unmet needs in treating wet AMD and DME? And when you look at it, it's really durability and improved visual acuity. Over 50% said we need to have better vision for our patients. Next slide. How about from a patient perspective? This is actually work by Viral, who is here with us today. What they looked at is what matters to patients. And when you look at it, vision outcomes are the #1 factor in patients' anti-VEGF treatment preference. And if you look at it, majority of the patients, no matter what age group they were in, they were getting treatments because they wanted to see better. Next slide. So looking at the emerging treatments, all of us here are involved with all these exciting innovation that are happening in our space, and they're focused on 2 things, better vision outcomes or durability. But when you look at what is in late stage development for better vision, we only have Sozinibercept or OPT-302. And that's the focus of our discussion today. Better durability, we are excited to have tyrosine kinase inhibitor that are pan-VEGF inhibitors that can actually help with durability, and gene therapy, which is looking at extended delivery, whether it's intravitreally, suprachoroidally, or subretinally. So I just want to emphasize that there's only one program that is in late stage that is looking for better vision for our patients. Next slide. So what is Sozinibercept? Most of you are aware of this, but it is a proprietary VEGF-C and D trap inhibitor. It has the potential, obviously, to address the limitation of VEGF-A inhibition. So when you look at wet AMD, we all know that it's a multifactorial disease, and as a field, we are looking at additional targets. But we know that treating patients with VEGF-A inhibition, there is an upregulation of VEGF-C and D, which drives angiogenesis and vascular instability. So the solution is if we can block VEGF-C and D with Sozinibercept, which blocks VEGF receptor 2 and 3 signaling, we can hopefully have better outcomes for our patients. Next slide. So what is the evidence we have? We have preclinical evidence looking at VEGF-C stimulation of retinal angiogenesis. When you look at VEGF-A and C, they induce vascular leakage and permeability. Looking at plasma concentration and aqueous humor concentrations, we can see that circulating VEGF-C levels significantly are elevated in patients with wet AMD, and elevated VEGF-C in aqueous humor following anti-VEGF therapy has been noticed in patients with wet AMD. And when you look at the mouse wet AMD model, you see the additive benefit of VEGF-A and VEGF-C and D inhibition. So we have enough evidence preclinically that shows that this is actually a very validated target. Next slide. So where does this fit in? So this will be the first advancement, if the trials are positive, to offer our patients with better visual acuity outcomes. Again, we have made significant progress in durability, and we continue to do that. But this is the only program that is designed to get better vision, and it has demonstrated strong clinical evidence for superior patient visual outcomes, with Charlie will cover here next. Next slide. So in conclusion, when you look at Sozinibercept, it seamlessly integrates in current treatment paradigm. What is there for all stakeholders? When you look at patients, they want superior visual outcomes so they can keep their driving licenses, they can be independent, and this can be administered at the same time when they're getting any other treatment for wet AMD. What is there for retina specialists? We always want our patients to have best outcomes in terms of visual acuity, and there's clearly a high unmet need to have better vision for our patients. And in clinic, this is designed to be agnostic to any anti-VEGF-A treatment, including biosimilars. And what is in for payers? Payers want better clinical outcomes for our patients so that they can have better health economics, and vision benefits is a key driver for reimbursement. So in conclusion, this is the only program in the late stage development that is designed to have better visual acuity outcomes for our patients. And that's what matters for patients as well as physicians.